Good morning, everybody. It's Kenny Lamons. Welcome to my channel, Medicare Millennials. Today, I want to make a video for those of you who are either new agents getting into the business, or maybe you just haven't done AHIP in a while. You're coming back to the business. I'm going to show you exactly how you get your discount, how you get logged into the AHIP website to begin doing your certifications, briefly run over what the different sections are, and then I'm going to give you 3 tips that are really important to help you get the very most out of your AHIP, okay? Before I jump into it, if you are interested in finding a new upline, getting connected with the right FMO, or simply you just want somebody, you want to kick by the FMOs and the uplines you're considering working with, considering leaving one to go to another, and you want some advice on if that's a good choice for you or not, reach out to me via my website. I'd be happy to do a one-on-one call with you and just make sure that you're going to get connected with the right partner for you going forward. Okay, with that being said, let me share my screen and we'll jump into it. Just coffee. Okay. So what you want to do here is get this thing out of my way. Right now, so you can use a link through various different carriers to log into the AHIP website to get the $50 discount. So let me back up real quick. You know that the reason that we do AHIP is because it's required in order for us to sell Medicare Advantage and prescription drug plan products. It's kind of a comprehensive training that goes over the Medicare program, Medicare Advantage plans, Part D plans, different enrollment periods. You can think about it as a comprehensive beginner training. Well, really, I'd say it's more than beginner. It's a comprehensive training for everything that an agent who sells Medicare Advantage should understand, from compliance to types of plans, so on and so forth. It's administered by this third party, AHIP, American Health Insurance Plans, or whatever that organization is, that acronym stands for. And it costs us as an agent $175 each time we take it. We take it every year. Whenever we have completed it for that calendar year, it certifies us to now go do our carrier certifications to be qualified to sell Medicare Advantage products for that year. Capiche? All right. It's for a newcomer. This AHIP certification we're about to get into, show you how to log into, is actually very cumbersome and overwhelming for a newcomer. However, as you'll see in one of my tips at the end, it's absolutely necessary. Okay, so don't be scared of it. Embrace it. As I mentioned, it costs $175 normally. People often ask, where do I go to do that? So I'm going to show you real quick. If you log in through a carrier, I'll give you an example with United Healthcare. Just log into your Jarvis account. If you have an agency, you've got to log in as your individual to be able to get to your knowledge center. You'll see what I'm saying if you have an agency. Also, if you have multiple writing numbers because your upline has changed, so on, you need to check with agent services to make sure you're in the right one. But nonetheless, we're going to go to the knowledge center. And then right here, it's going to say it's time to certify. So we're going to click get certified. And then now I've already done the fast track for United Healthcare, but I still need the AHIP certification. So I'm going to click begin standard certification just so I can click the AHIP button here and go down, click it one more time, right? Yeah. If you do the standards or the fast track through United Healthcare, you still need your AHIP certification for other carriers. So click to launch. Now, you're going to log in here. Your username is typically going to be your MPN. If you don't have an account, you're going to click create new account. Notice this took you to ahipmedicaretraining.com. You could go here directly to do your AHIP training, but you won't get this $50 discount if you don't go through one of the carrier links. So I'm going to log in. So it's just the United Healthcare site. So you'll notice I can't show you because I already paid for mine, but I have my certification up here now. And instead of paying $175, I paid $125. You get a $50 discount going through the carrier link. Okay, now let's click on this. I've done the first two modules. I should finish up these last three over the weekend because for me, there's only a few new things every year. Everything else is just a refresher. So I do run through every question just to get my refresher. So what is included in the AHIP certification? So there's 5 modules, a final exam, in the fraud, waste, and abuse portion, which is pretty easy. Module 1 is an overview of Medicare program basics. Module 2 is the different Medicare health plans. So it's going to go through all the different types of Medicare Advantage plans. I promise you, several of them you've never even heard of and you'll never sell, right? But so you can still learn about those. Still useful. You just might not sell all the various different types of plans. Module 3 is Part D. This one's important this year. Mega massive changes for Part D going forward in 2025. Coverage gap is gone. New max out of pocket of $2,000 a year. Something called a smoothing process. Massive changes in Part D. If you're a recurring agent, take your time. Pay close attention here. Marketing Medicare Advantage. So this is a lot of compliance guidance. So really, if you want to do seminars, you want to do sales events, you want to do direct mail, you want to be a phone agent, here's where you can go. Quit trusting only what people say on YouTube and on Facebook. And maybe your FMO doesn't know what they're talking about. You can at least get a foundational understanding of compliance every year from Module 4, Module 5's enrollment, take your test, do your fraud, waste, and abuse, and you're done. Now, couple of tips. Number 1, take your time. I don't care if you've done this before or it's your first time. So much to learn, so valuable. Do you really want to be a great agent and do you want to be a professional in this industry, or do you just getting through this to be a product pusher? Take your time and learn this stuff. Number 2, when you finish doing your test, you get your certificate, you're going to have the option to get, look, if I go home here, you see the CE. Must complete and pass the final exam in order to purchase credits. You're going to get the opportunity to buy, I think, depending on your state, anywhere from like 5 to 10 CE credits. Make sure you capitalize on that. I didn't do that the first couple of years that I was doing this. And those 8 hours in Texas go a long way for my 24 hours I need every 2 years. Okay. So take care of your CE certification. And then thirdly, don't put this off. If you have not done your AHIP yet, do not drag your feet. I promise you this year is going to be bringing massive changes. And the worst thing that you can do is be late to the game with doing carrier certifications. I think that there's still a lot of surprises in store for us as Medicare agents before this AEP kicks off. So I encourage you to get logged in and get this part of things done. I hope it was helpful. Reach out if I can help you guys connect with the right upline or provide any coaching. You can get that at our website. Have a good day.